Hi, my name is Colby Ashford, and I am a senior at McKinley Technology High School in the Biotechnology Academy. The topic I researched is the onsets of lupus affecting one on a community and base level. I thought this topic was interesting and reliable because it's something I've been exposed to my whole life. This topic also caught my attention because of the indifference shown towards the disease itself. Also, lupus isn't very common within the teenage society or talked about enough to me. Lupus is basically a disease that occurs when your body immune system attacks your own tissues and organs. This can lead to many complications within the body and can be fatal if it's not treated or taken care of properly. Furthermore, I chose three topics surrounding this project. One being lupus affecting someone mentally, two, the medications and treatments for lupus, and three, lupus among different sexualities and races slash history of lupus. Lupus is a disease that basically is kind of unpredictable and it can do what it wants. This can bring on lots of stress, leading to mental health issues like depression and anxiety. Given lupus is an autoimmune disease, it does put you at higher risk for mental health issues than your average person. Also, with the many medications lupus patients are given, this can increase your chances of having depression or anxiety, especially when diagnosed at an alert age where you understand your mental stability and how much you can take on and how much you can't. This leads to my next section topic regarding the treatments and medications for lupus. For one, there is no cure for lupus, unfortunately, and medications and treatments are basically mandatory and seen in the everyday life of someone with lupus. Medications can have several effects and mood changes within the mindset of someone with lupus. It isn't easy adapting to a new diagnosis so severe and not expect any change or instability within the mind. The medications and treatment do indeed affect everyone differently because everyone's lupus levels are different and are battling different concerns within their body. For example, someone with an acute kidney condition caused by lupus could be on a steroid called prednisone, causing slight anger, feeling anxious, increased appetite, and severe mood changes, as opposed to someone with a normal rash and they simply need, some rash cream to ease their worries. Everything is indeed different. Contradicting different within the lupus community leads me to my last topic within which is the history among sexualities and races and the history of lupus. Lupus affects 99% of African American women between the ages of 14 through 60. Yes, other races are diagnosed with lupus, but black women are the number one. People often only view lupus as a female dominant disease, but men do indeed get diagnosed with lupus. It is very rare that a child under 10 is diagnosed with lupus, but it certainly can happen. African American women with lupus often suffer more from strokes and heart attacks and seizures than the other races and groups. I believe this can be traced down in history because of the limits African American women had access to and were treated during the times before. Ultimately, this whole project was a blast to discover and research and do my literature reviews and everything on. And I truly enjoyed this topic and working with it as a whole. I would like to thank Dr. Schuster and my mentor, Mr. Isaiah Brown, for helping me through my project and making sure I stayed on track with all of my deadlines and everything, and also being good people outside of the class for me to reach out to. I want to thank the judges and thank you all for listening to me and learn about my project. Thank you.